And with that, I want to introduce a good friend, good patriot, superb physician, Dr. Scott Westlow. And come on up, Scott.
Okay, we're going to get this thing started with a bang.
Who's in charge? I am. Once again, who's in charge? You are. Excellent.
Okay, so sorry about the violence, but hijacking is not really a passive activity. Well, we chose the word carefully. Hijacking, the analogy is very real when you compare it to what's going on in healthcare. So why don't we watch that again and maybe label some of the parties involved in this hijacking?
Who's in charge? I am. Once again, who's in charge? You are. Excellent.
Okay, so we're not mincing words tonight. This is what's going on. Doctors are supposed to be the pilots of medicine. We're supposed to fly the plane, and the patients are the passengers, and helpless in this situation, really. And the doctors' control over the plane has been hijacked by these entities. We're going to call third parties. So, Americans' worries. This is a recent Gallup poll. The worries of Americans in 2026. Look right at the top, and you're going to see healthcare right there at the top. It's very unusual to beat out the economy, as you know, as the number one issue on Americans' minds. It didn't just beat it out by a little bit. It beat it out by 10 points. That is saying something. That is why we are here tonight. Okay? So, we introduce Marcia Engel. She's a physician at Harvard currently. Sorry if I'm cutting out a little bit at times. She said this about our healthcare system, and it sums it up pretty well. So I'm quoting her. If we had set out to design the worst system that we could imagine, we couldn't have imagined one as bad as we have. Okay? Couldn't think of a better summary, so I used her. We're going to get back to her actually in just a little bit. So, there are three parties in medicine right now. The first party is you. You are the patient. The second party is the doctor. And this is all medicine is supposed to be. These two parties. But we have a third party now. These are the hijackers. And from now on through the talk, we will refer to the hijackers as third-party systems. Okay. So who are they? You've seen them in the video, so I gave away a little bit. Hospital systems, used to these symbols, they'll be used throughout the talk. Healthcare, or health insurance companies, the federal government, and to a lesser degree, state government, and the pharmaceutical industry. So, we're going to start at the bottom. The pharmaceutical industry, I put as the least of the worst, but by no means should they be ignored in what's going on. You're going to see why here. Okay, so the U.S. is one of only two countries in the world that allows drug companies to advertise on their TVs. The other one's New Zealand. So it's not a nice distinction. It's not good. It's not normal throughout the world that this is happening. And they're using it to the hilt. $6 billion in 2024 spent by drug companies on TV commercials. It's even more now. Probably much more. You watch TV, maybe, some of you. Every other commercial is a drug, isn't it? It's crazy. The ones that have, in the Super Bowl, when you could tell who has the money. Whoever's advertising, they're making the money. And so the pharma's making money, aren't they? All right. So in 1992, something happened that not many people know about. It was called the Prescription Drug User Fee Act. It was passed in Washington. And what this is allowed the FDA to collect fees from drug companies to fund the approval process of the drugs. Does this strike anyone as a conflict of interest? Okay. So they're going to collect these fees from the drug companies. And they're collecting them. Guess how much? $300 million just last year. The drug companies paid the FDA in fees. Now, we've all paid transaction fees, haven't we? Processing fees, administrative fees. Does 300 million sound a little high for a processing fee? Yes, it is very high. Why is it so high? Because it's not a processing fee. It's a bribe. Let's just call it what it is. The drug companies are bribing the FDA to get their drugs through. I can't even take a pen from a drug company and use it in my office because that would be a conflict of interest. And I might write for that company's medication over another because I'm using their pen because they gave me this $2 pen. The FDA is taking $300 million a year. And they're not going to be influenced? Are you kidding me? Okay. Obviously, the drug companies have control of the FDA. We can come up with multiple examples. This essentially put the FDA on the payroll of the drug companies that they're supposed to be regulating. How can this happen in our country? Okay, back to Marcia Engel. Now, she was chief editor of the New England Journal of Medicine, the most prestigious medical journal in the world. She was editorial staff for 21 years, chief editor for a little over a year. Now, the New England Journal of Medicine, when something's published in there, as physicians, it's the gold standard. You say, okay, this thing's been vetted to the hilt. The science is good. The science is true. I can believe this study, and I can base my practice on it. Well, what she says, because of this drug company corruption, this person at the most prestigious medical journal in the world said, it is simply no longer possible to believe much of the clinical research that is published. She did not exclude her journal when she said this. So, the very studies and data that we as physicians are using to tell you what to do, to recommend a medicine, because this study showed this and this study showed that. We use these studies to tell you what to do, to tell you when to get a procedure, when to be on a medicine, what kind of medicine. It could all be corrupted. We might be giving you things that aren't helping you and maybe even hurting you. Okay? What can we believe now? This is what's happened to our industry, to our beloved profession of medicine. She said she reached this conclusion slowly over 2 decades, and she takes no pleasure in it. Of course she would take no pleasure in it. This was her whole life. And she would admit it was corrupted. Okay, and then you hear peer-reviewed journals, peer-reviewed articles, okay? It's now coming out that the peer reviewers are on the payroll of the drug companies. Okay? So peer review study usually means it's been looked at by a well-respected, knowledgeable, and experienced group of physicians, and it passed. Well, they're passing because they're getting some money to do it. Okay? So tough time in medicine right now to know what to recommend and what not to recommend. You almost got to just recommend what you see with your own two eyes and what you have experienced in my case, 20 plus years of medicine, and Dan's 40. I don't know what these poor people coming out of medical school are going to do. They have nothing to go on experience-wise. They have to trust these studies, and they're not trustable. Okay? So, hospital formularies. We're staying on our pharmaceuticals now. A hospital formulary is the medications that a hospital keeps on its shelf to give to patients who are admitted to their hospital. Well, obviously, the drug companies want their medicines on the shelf. Now, when I was training, was the cheapest drugs that they would have on the shelf because the hospital was getting the generics. Makes sense. Why pay up for brand names? You can get the generics, you put them on the shelf. So when I was training, a patient would get admitted to the hospital, an expensive brand name medicine, and we would switch them to the generic one because that's what we had on our shelf, and that makes sense. It's the same medicine, okay? But the drug companies said, wait, so what if we give our most expensive medicines to the hospitals to put on their formulary, but give it to them for pennies? Give it to them dirt cheap. Then those are the ones that will be started in the hospital. And then when they're discharged, the patients are on the most expensive medicines. And then the drug companies make their money after discharge. Way more money. You're in the hospital for 3 days, 4 days. You're discharged on a medicine. That's a lifetime sometimes you're on this medicine. Okay? This is the manipulation going on. They make up their money after the discharge, dirt cheap to the hospitals. Okay, Jardiance. I'm here to tell you Jardiance doesn't save lives. But they said it did on TV many times. Okay, so how can they say this? Are they just lying? Actually, they're not lying. They're just manipulating data. Okay, here's how it happens. An endpoint of a study is the goal of the study. So they say, we're going to give Jardiance, and one of our goals is going to be to reduce mortality, improve survival. Well, that's the gold standard. If you can reduce mortality, I'm going to give that medicine every time. It's my job as a doctor to help you live longer. Okay, so, but when you have a composite endpoint, you're adding more than just one thing to the goal, more than one endpoint. So they added reduced hospitalizations to the reduced death for their endpoint. They did their study. Guess what? They reached their endpoint. Yes, Jardiance saves lives. We can now say that Jardiance reached its endpoint. But wait. When you tease out the data, you find that if you take the reduced hospitalizations out, they didn't improve mortality. Okay? So, say they reduced mortality because they reached their composite endpoint, but when you tease it out, it doesn't save lives. This is going on all the time. This is not unusual. Unfortunately, this is not unusual. The tinkering and the manipulation of medical data to make it say what you want happens all the time. So, before you can get discharged from the hospital, if you get admitted with heart failure, you're going to have one of these filled out on you at discharge. This is right from the hospital. They'll have them. These are quality improvement sheets, okay? They're box checking. So, if you get admitted to the hospital with heart failure, the person discharging you has to fill this form out and check certain boxes, or they get dinged for quality. Okay? So, you're going to be on this one, and this one, this one, and this one, and this one, at the very least. So if you come into the hospital on no medications, and you're diagnosed with heart failure, going to leave on these 5. And actually, this top one here is 2 medicines in one. So you're going to leave on 6 new medications all at once. And let me tell you a little something about these medicines. Let's just go through them. This one decreases blood pressure and can affect your kidneys. This one decreases blood pressure. This one decreases blood pressure and can affect your kidneys. This one decreases blood pressure and can affect your kidneys. This one, oh, there's our Jardiance. The SGLT2 is the Jardiance. It made it on the sheet. That's their goal. Okay? And so Jardiance got to be checked, and that one's going to affect kidneys too. So they're going to start 6 new medications, 4 of which lower your blood pressure. 3 of which lower your blood pressure, 4 of which can affect your kidneys. Why do they have to start them all before you leave? Why can't we just put a couple on, see if your kidneys tolerate it and your blood pressure, and then add a couple more as outpatient? Can't do that. Why? Because studies show if the medicine isn't started in the hospital at discharge, it's way less likely to be started as outpatient. They know this. So they make us put them on this all at once. And we have people coming back at 2 weeks. They're passing out because their blood pressure is 80 over 50. We do their labs and their kidneys are failing. But each of these medicines improves heart failure outcomes individually. Fine. Then add them individually. Don't lump them all on at the same time. But you got to do it before you leave the hospital or you get dinged for quality, because then it might not get started. Okay. So that's the pharmaceutical industry. That's the least of the corruptors we're talking about tonight.